So the HIP QIP project started back in 2010 when Northumbria was struggling with high mortality in patients with a hip fracture. What we learnt was there were several interventions that were evidence-based that we could do to improve care. The headline aim of the collaborative is to save 100 lives.
It gave us a really good opportunity to kind of really look at everything that we were doing from the ground all the way up to the sort of top sort of management side of things.
So it's not about making big changes or big transformations. It's about little things that have massive effects actually, and because at the time we had no proof of how effective it was going to be, we were implementing measures that did in fact cost money without showing how much of a saving we were going to be making in terms of quantifying mortality and things. This is where Northumbria came in because they were able to make business cases, run trials based on previous experience. So the biggest challenge was convincing people it was going to work even before we knew it was going to work.
So the scaling up project for us has given us tremendous help organising the collaborative. The Health Foundation have appointed RUBIS QI as the educator, if you like, for the collaborative, and they've given us great support as we've had our events and also training going through, and that's given us the confidence really to begin to scale this up into a bigger project.
The key focus of our look at nutrition was to try and improve the help that patients would get with eating both main meals but also having snacks in between to try and build up their calorific intake, and we have appointed nutrition assistants who have a role of being dedicated nutrition assistants. Because we felt this was so important, it became a major part of our scaling up project.
The best thing about my job is that I get to spend real quality time with the patients. I'm able to go and sit with them for a little while, discuss the menu, discuss their food options. I speak to them and their family and discuss the sort of things that they like to eat, and being able to make them understand that what the nutritional information I've given them now is something that they can take forward when they go home.
The traditional model that people who come into hospital, as soon as they arrive in hospital, we often deprive them of food because we're hoping to get them to the operating theatre. There may be delays that mean that they have prolonged periods of starvation, and it's become obvious that this is not good for patients' health.
When we looked at how much our patients were walking or mobilising, they probably weren't doing a great deal.
So what we've done is we've done a lot of teaching on the wards to give them confidence in order to get people out of bed early on.
With the physiotherapists and occupational therapists, we do like a tea party and exercise sessions.
So we run that once a week for about half an hour. Patients absolutely love the group.
They're more active, they don't feel they're in a hospital, they forget about that for a minute.
They help me walk, and I'm going to do that in the future now. I've got to get back on my feet, to get back into life. So that's what's going to happen now, I've got to. So I've got to look after my wife.
Well, I think the big benefit really has been the reduction in mortality. Actually, we're performing much better than the national average now. So we've gone from being a negative outlier, which means we're worse than average, to being a positive outlier, which means we're much better than average, which actually is a massive improvement. But actually, if you think about the patient experience now, we look at mortality as a hard figure, but there is that other side, what we call the morbidity. What are things like our rates of chest infections, pressure sores, malnutrition leaving hospital. Nobody actually ever really measures that. So actually, they have a lot of clinical improvement, and actually they feel better while they're in hospital.
So to date, the HIP QIP collaborative is working really well. We are well on the way to saving our 100 lives. Now in the future, what we want to do is to increase the evidence around the HIP QIP intervention, perhaps work with a few more trusts, and then eventually we'll be aiming to change national policy, probably through best practice tariff, and that way we can begin to save a huge number of lives across the UK.